Divine Design Natural Health, and we are here at Healthline 2020. Say something if you guys are here. Of course. I just wanted to throw them a curve. They're always ready to yell. They just don't know what they're yelling at sometimes. So we're at Healthline 2020. This is kind of a retelling of something that we did. How many of you were here? Some of you hadn't even heard of us back then. You were here. You were here. Some of you had not even heard of us back in January. We did the backbone of this class back in January, kind of foretelling what was going to happen for this year. And I think, as you'll see, it was kind of right on time. These are based on some of the predictions from the WHO, the World Health Organization, which, if you didn't know who the World Health Organization was before March of 2020, you most certainly do now, because you hear them all the time. Just remember, when we go through this stuff, it's pretty much word for word from that class that we did back in January, and I want you guys to really see how much this predicted what was going to happen. Are you all ready to get started?
Yes.
Fabulous. A little bit of housekeeping before we get started. People online, what you can do, online attendees, you can get rewarded. Because we kept hearing people say, hey, what about I can't come to the class and I want to fill up the little card and I want to spin the wheel and I want to do the Wheel of Fortune thing, but they're far away or whatever. So we said, well, let's do an online participation 2020 participation trophies, right? So people can do online stuff. So here's all you got to do. You got to tag 3 friends. You have to kind of give us tell us your location. That's another entry. You get another entry. And then comment on your take home at the very end. What's the biggest thing you guys learned for all you people at home, okay? And in October, the winner for September will be announced. We just started this at the beginning of September. So pretty soon, all of you people who entered in September will draw somebody out of the primordial soup for October, for the winners for September. Does that make sense? Everybody, share this stuff with somebody online, send it to somebody, and you might save a life. You never know. Vitamix series, or the Vitamix entries. Vitamix we're going to be giving away, I think it's in November. So how do you win that? You refer a friend, they come in, they become a patient, you get a ticket. You refer somebody else, they come in, your second person, that you get two more tickets in addition to the one that you already got. Next friend comes in, guess how many tickets we give you?
3.
You're sharp, yes. So then you'd have, for referring 3 people, you would have 6 tickets, and it just goes up and up and up. So if you guys want to win a Vitamix, Kathy Llewellyn has already pretty much claimed it, but you guys can fight her on it. You guys can do this, okay? Let's get right into this. That's the housekeeping. Oh, and next week, hold on. Make sure everybody gets one of these. This is our 2020 Fall Well Works schedule. So starting next week is quarter 4. So that's going to be all of October, November, and December. So October 2015 or October 5th, 2020, Vaxxed 1 movie night. How many of you were here when we had 60 people when we showed the movie Vaxxed 2? Almost the entire room. Vaxxed 1, we're going to go back and show you that first movie, what started that whole thing. October 12th, we're going to do Darkness to Light, Exposing the Lies, Part 6. That's what we've been doing ever since this mid-March thing. And we're not saying that we're going to continue doing, CV19 related stuff, but we're going to expose some lies every one of those weeks. So regardless how long this thing, balloons out or how long it falls apart after November 4th, we're going to still be exposing some lies, okay, on every other week. On the 19th of October, how much is your life worth? How many of you might want to come to that? Because we're going to have it'll be like a panel discussion. It'll be a few families of patients and what they did to save a bunch of money, to get very healthy, and to not have to pay for health insurance. Something everybody might want to hear. 10/26, Darkness to Light, Exposing the Lies, Part 7. Then we've got one on November 2nd, Change Your Mind, Change Your Life. That's going to be all about mental health. If you know somebody with anxiety or depression or bipolar or schizophrenia or something big that people have said, some mental thing that's going on with somebody, you might want to check this out. This might help you. This might help you help them. November 9th, Darkness to Light, Part 8. Then on November 16th, all you oily people out there, put it on your calendars on November 16th, Essential Oils, Biblical First Aid Part 4. That's going to be the Part 4 of the Part 1, 2, and 3. Come study it up and make sure that you've watched Part 1, 2, and 3 on YouTube or Facebook if you want to know more about the Biblical First Aid. And then November 23rd, Darkness to Light Part 9. December 7th, how many of you have been to our Lies Doctors Tell classes? Yes. So Lies Doctors Tell Part 4 is coming up. I'm sure that there will be multiple parts of that going into next year and beyond. There will be plenty. And then on December 14th, our last one for the year, Darkness to Light Part 10. There we go. Now, what's that? Something's crazy? Yeah, the whole year gone just like that. All you need is a pandemic and the year goes by in a heartbeat. Never knew that. All right, let's go to the our catalyzing statement here. This is why we're here, folks. Everybody knows this? In the sacred service of saving lives ahead of time, we are globally freeing billions of beings through all natural biblical health care. That is why we're here. That's why you're here. That's why you want to know what we're doing, because we do things all naturally. No drugs, no surgery, no kidding. How many of you know you live in the greatest technologically advanced society on earth? How many of you also know we have the crappiest healthcare on planet Earth? Everybody knows it. Nobody wants to say it, but everybody knows it. In the emergency room, that's different. But everything else, in the emergency room, very different. We'll talk more about that as time goes on. So with Healthline 2020, what we're getting into is, I put this together back in January. This was the first class we had of the year back in January, before any of this nonsense that's currently going on was going on. Healthline 2020 was all about what's new in healthcare. Here's what you need to know in 2020 concerning your health and concerning your longevity, okay? And we went into some trends. I think the slide is in here somewhere, right? Let's just go to the slide, the trends in healthcare. We were going to go to the website and kind of show you some stuff, but here's the deal: trends in healthcare. If you were to look up and kind of research big trends in healthcare right now, what are they? What's everybody looking for? What do people want? What's the product that people want? And what's the problem with delivering that product and getting it into the hands of people? Well, these are the trends in healthcare as of the beginning of the year. One is transition to value. Number 2 is consumerism. I'll explain what these are. Consumerism, in other words, health ownership. Number 3 is consolidation of services. And number 4 is transformative innovation, okay? So trends in healthcare, number 1, there's a transition to value. In other words, what people are seeing here with their value is they're saying, I'm not getting the value for what I'm paying in premiums and deductibles and copays back in the product that I wanted. So there's a big trend in healthcare where people are, looking at the transition to value, and they're going, I don't get the value out of what I pay. I pay, I don't know, who's got an insurance premium that they're paying?
We were paying like $300 or $400 a month.
You were paying $300 or $400 a month. So do the math. That's $5,000. How much? 500 a month. 2 people, 500 a month. So that you were doing 400 a month. That's just to have insurance. Like, that's not you and the husband and 3 kids. That's just entry level, like, I want to get into the line at McDonald's. You're paying to stand in the line. That's what that is. Come to our what's your life worth or what's your health worth, whatever it is. Come to that in a couple weeks, and we'll show you some interesting stuff. Will here said $500 a month. That was just you and your wife. Boom, $500 a month. So if you multiply that times 12, what is that? 6K. But you're forgetting, once you've already paid the amount to stand in line, what more do you have to pay? Only in the business of insurance. No other business can you buy a product and then pay again for the same product.
It's a scam.
It's a total, like, if you didn't see this one coming, don't be standing on any X's anywhere if you didn't see this one coming. So you've got a 5K premium just to have the product. Then before you can actually use the product, you have to pay another, how many K deductible? 5K deductible. So you're in 10K deep before anything has kicked in. You were, what was your deductible?
Quite a bit. By getting
Quite a bit.
member insurance, we all saved by the end of $20,000.
Oh, yeah. So
That's
by,
with our entire family of 5
yeah,
being patients here.
Yeah, beautiful. So see, we're going to go somewhere in a couple weeks. And having a baby. Probably the cheapest pregnancy you ever had was the last one. Interesting. Given inflation, that should not be the case. But you were paying a bunch of money. What did you think about the product that you got? Goose said, what do you think about the product that you got? It's never been a good product, right?
I'm paying for nothing.
Problem one, everybody's experiencing it. Transition to value. That's what we're talking about. Next, consumerism, health ownership. Basically what this one's saying is there's going to be, more people are going to, the trends in healthcare are going to be more people are going to be exercising, and there's going to be more options for prescription coverage. Everybody wants, yeah, that's a trend in healthcare that's going to take off, just make people exercise more, which they're not doing already, right? And then also make sure that you can get more prescriptions. Who in this room wants more prescriptions? Who in this room thinks there needs to be more doctors writing prescriptions? Number 3, consolidation of services. This one should excite you. Let me see. Where you can go to one place and get all your imaging, your managed care, and all of your end-of-life controlled euthanasia services all in one, all under one roof. Long-term euthanasia services. They want, consolidation of services so you can have an emergency room, hospice care, and everything all in one fell swoop. Once you're confined by a certain radius and you can't leave the big cities, they want everything under one roof. But see, this is a trend in healthcare that, I was just kidding, it shouldn't excite you. Consolidation of services. This one here, actually, wait, this one should excite you. This one is transformative innovation. This is what the trends in healthcare, remember what the trends are. This sucks.
Yep.
Stuff people aren't going to do and people nobody wants, increasing the prescriptions, right? Consolidation, well, this sucks. Transformative innovation, tell me this one doesn't suck. This is where people are excited about new apps, right? Where you can do your electronic health records, you can have your heart rate, your blood pressure, your emotions tracked on an app, on a phone, so that now this can be updated to a satellite, and so that the 5G towers can have a complete and total domination of everything in your body. Basically, here's the deal, and we'll get into this farther down the road in future classes, but the future holds something going under your skin so that then your blood pressure, your heart rate, your pupil dilation can all tell if you're lying. That's where it's going. No, I don't know where so-and-so is, or no, I don't have any guns, or no, I don't know where that is, or yes, I got my shot, or whatever. They'll instantly be able to tell as long as you're 6 feet away from each other. We won't get into this now. You see where this is going, though. They'll instantly be able to tell if you're lying based on your heart rate and your blood pressure and your perspiration. So, other thing about transformative innovation, everybody wants to have robotic surgeries because they're faster and with no errors, like from those pesky humans, right? And then transformative innovation, Apple Watches, surveillance tracking things that you pay for to track yourself. It's a wonderful idea. You're doing all the work for them. It's crazy. Look at my fancy iWatch. And now, they have every bit of your heart rate, blood pressure, and everything on a record. That's perfect. You're paying for that. Other thing is, and this is a good one too. Transformative innovation. This is where we're going with transhumanism, data harvesting of your DNA, which you provide them for free as well, by the way. They don't have to pay for that. You provide it for free and send it in the mail to Ancestry or 23andMe. But the transformative innovation side of things is everyone's pushing towards, what's that word? It starts with a T. Trans with a human in it. Transhumanism. What is that word? Everybody's pushing towards melding machine and man. So that's where this one sucks, and that's why I'm saying all of these trends in healthcare, this is what you're looking down the pike of. Are you excited? So this transformative innovation is pushing towards your transhumanism, where you get a microchip in your brain, or you get a little thing under your skin to be able to track and do those things that you're supposed to be doing. Digital health tools. This is another thing, too. I didn't put this on here. I just wanted to talk about it for a minute. Digital health tools. Think of this. This is the implementation of remote patient monitoring by leveraging connected and wearable devices, sensors, and trackers that will be platforms that gather patient-generated health data to facilitate disease management and patient engagement. This sounds like a great way of saying We're going to put something under your skin that we can track, we can sense, you can wear it, it'll be leveraged and connected by monitoring, and we can track you and sense everything and gather all your health data to facilitate disease management. That's just a great way of saying a whole lot, a big mouthful of just saying we're going to track you. Those digital health tools, they all go under right here, transformative innovation. Are you excited for the future of healthcare? Pepper is excited out of her mind. She's excited for all this crazy stuff. All right, now let's see. Now let's go forward and see what are the WHO's, the World Health Organizations. Let's just see what were their their top 10, the top 10 global threats to health. This is coming from 2019. So remember, we did this in January. Let's check this out. It's the World Health Organization's website. 10 threats to global health in 2019. Okay, so this was March of 2019 was when this apparently was first published. We did this class, I think, probably January 20th of 2020. So I said, well, they didn't have we couldn't find the top trends for 2020, but I said, well, let's go and let's do the top trends for 2019. They can't be that different. You'll be shocked. Check this out. The world's facing multiple health challenges. These range from outbreaks of shot-preventable diseases like measles and diphtheria. That's debatable, right? Increasing reports of drug-resistant pathogens, growing rates of obesity and physical inactivity to the health impacts of environmental pollution and climate change, and multiple humanitarian crises. That one sentence right there contains so many question marks we won't get into right now, but the climate change thing and the environmental pollution, and multiple humanitarian crises. There's a lot of stuff going on in the world, let's just suffice it to say. To address these and other threats, 2019 sees the start of the WHO's new 5-year strategic plan, what they call the 13th General Program of Work. This plan focuses on a triple billion target, ensuring 1 billion more people benefit from access to universal health coverage, 1 billion more people are protected from health emergencies, and 1 billion more people enjoy better health and well-being. Reaching this goal will require addressing the threats to health from a variety of angles. So here are 10 of the many issues that will demand attention from the WHO and health partners in 2019. So remember, this was pre-COVID, this was pre-CV19, this was a year before. This is what they were saying in 2019. Air pollution and climate change, number one problem. Number one problem that you're being told is happening. Will, remember last week? Was that last week? We were talking about carbon dioxide. We showed Bill talking about population reduction openly, out in the open, talking about murdering, or at least soft killing, billions of people, right? So that we have the carbon emissions down. What was it you said about climate change or about global warming?
If he wants to eliminate carbon dioxide, we're all going to die and freeze.
Right.
Or freeze and die. Let's go that way.
Depends on
Freeze
if,
and die.
yeah, do you want
And
to
then
freeze
the
first and then die
plants
later?
Breathe carbon dioxide.
Yeah, plants.
Have that.
Right.
It doesn't make sense if that's what he
Right,
needs
right,
to go to zero.
right.
Doesn't
If you want carbon emissions to go to zero, you're going to have some big problems with plants are going to have big problems, right? We're talking plants like the ones that grow out of the ground, not the ones that manufacture things and put smoke in the air. We're talking all plants. That's a lot. That's a big problem, right? So air pollution and climate change, we're being told that we're the viruses. We're being told that there's not enough food. We're being told there's not enough space. We're being told that the climate is going out of control and we're driving up the numbers. And if you just pay more in taxes, the government, who can't stop a virus, will reverse the planet's temperature. We can't find the paperwork. We can't find 30,000 emails, but we can reverse the temperature of the world. All right, you got it. So 9 out of 10 people breathe polluted air every day. In 2019, air pollution is considered by WHO as the greatest environmental health risk. So where'd all the fires come from? Huh? Who cares? Well, I mean, the greatest environmental health risk. You got to wonder, like, what's up with the population? What's up with the pollution? But what's been going on in the air a lot lately? What's been happening to the air quality in this nation, at least? What's been happening? Anybody? There's been a lot of. Wow. That's been chemtrails. We'll talk about that here in a minute. Yes, some people think that's a conspiracy. even though it's right out there in the open. If you call it a different name, it's everywhere. It's geoengineering. Stratospheric aerosol geoengineering, that's what it's called. You say chemtrails, they think you're nuts. But what else has been going on in the media? What else has been burning to the ground? What else? 3 states, yes. Like Washington, Oregon, California. But somehow the fires don't have Canadian passports because they stop right at the borders. It's very interesting. So, microscopic pollutants in the air can penetrate respiratory and circulatory systems, damaging the lungs, heart, and brain, killing 7 million people prematurely every year from diseases such as cancer, stroke, heart, and lung disease. Around 90% of these deaths are in low and middle income countries. The primary cause of air pollution, burning fossil fuels, is also a major contributor to climate change, which impacts people's health in different ways. Between 2030 and 2050, climate change is expected to cause 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress. I think that's really all we needed to read there, but just keep that there for number one. The biggest thing is air pollution and climate change, right? We're going to show you something here right after a brief commercial break that will tell you that that's not right. Let's check this out.
All right. So for anybody who's new, either here or online, I'm Andrea. I'm a patient advocate here at Divine Design. And my family, I don't know if you heard me say from the side, my family also comes here. We're all patients before I ever started working here. So this topic of, getting rid of stuff that you're paying for and getting nothing out of is kind of near and dear to my heart. This is a testimonial that one of our patients wrote for her husband. She said he had restless leg flare-ups and those would happen quite frequently. He has been taking a supplement for only 5 months, and restless leg flare-ups are way less often, but when it does happen, he reaches for the Biodent instead of Tylenol or Advil. Yay. Take that, Pharma.
Restless legs, that's a whole separate topic. But yeah, if you can fix something with just some minerals, some vitamins, stuff that's been around for thousands of years rather than a pharmaceutical poison, then yeah, you can help people live longer. Yes? Everybody agree with that? I think so too. So the air pollution and the climate change, let's just go to this next, the link here, the geoengineeringwatch.org. Everybody needs to know what this is, okay? Does anybody know about geoengineering? Everyone in this room should raise your hands. What do I mean by geoengineering?
Those are those genetically modified things that they put stuff in.
Geoengineering? No. Well, yes, I could say, yeah. You know what? You're right. Yeah, geoengineered, genetically modified. Yeah, I didn't clarify. Yes, geoengineering, though, here is this. It's this. Okay? If you call it chemtrails, you're just a conspiracy nut. If you call it what the government calls it, stratospheric aerosol geoengineering, then you're a scientist. So geoengineering is the artificial modification of Earth's climate systems through 2 primary ideologies. Look at that. Artificial trees, ocean fertilization, solar radiation management. These are the 2 ways you can do it. You do solar radiation management, controlling sunlight before it reaches the planet. That's Bill's other topic that we had. We had Bill saying he was going to dose, hundreds of millions of pounds of calcium carbonate to block out the sun, to calm down global warming. Yeah, so the aerosols are dispersed via jet aircraft trails that expand and reflect. It's crazy, isn't it? You can't make this up. But this is a big website. So geoengineering, solar radiation management, and carbon dioxide removal. Solar radiation management, blocking out the sun. Carbon dioxide removal, right here. This is artificial trees, ocean fertilization. These projects are declassified for the most part. The method is not the focus of this website. This method of geoengineering is not the focus of this website. That's removing of carbon dioxide. This is managing solar radiation. So let's just scroll back on that, or pull out on that. And you can put all kinds of, fill in the gaps there, stratospheric aerosol geoengineering. Go up to the top here. This is a very informational site. It's got crap all over the sides. It's been around for a long time. Dane Wigington puts this together. There are, if you click here on geoengineering, or just hover over it, I guess. Come down here to some of these, there are tons of articles. You can see people working on the jet stuff in the tanks and the spray mechanisms on the planes. They're everywhere. It's all chronicled. It's all documented. Dane Wigington is the head guy behind this. He has put so much of his life into all of this. This is chronicling all of geoengineering. In other words, you go outside, you look up in the sky, you see these white clouds. You see these straight white clouds that you did not grow up with, right? You did not see these clouds growing up. Everybody know what I'm talking about? They're straight, they're long, they don't disappear. It's not condensation trails, it's chemical trails. So you just need to look into it. It takes about 30 seconds to look into, and you will see why you're having problems, why so many people are having problems, digestive problems, breathing problems, why plants won't grow anymore, why colony collapse disorder is going through the roof, why you got flocks of birds falling out of the sky. And nobody seems to be able to put this together, but the meteorologists know about it. It's interesting. So I would say look into that before you would look into any other reason as to why is the climate changing? Well, it can't be because we're launching aluminum and strontium and barium and all this other nonsense out of the backs of planes for hundreds of thousands of miles per day, right? And these people are flying all over the place. They think they're doing it for global warming. They're not doing it for global warming. So the first massive global thing that we need to be excited about is an outright and complete total fabricated nonsense. Does that make sense? Let's go to this. And just make sure to go back to that site too. You guys can look at the documents, the patents, the resources. You can look at HAARP, high altitude atmospheric radiation pulse. You need to look at this stuff too. Don't worry about it. If you already killed it, don't worry about it. But there are there are 2 other wellness workshops. Yeah, just check with me before you go killing the links. 2 other classes that we talk in depth about this. One is from July of 2017. It's called Look Up in the Sky. It's a checkerboard. You can watch that. It's on Facebook. It's on YouTube. Whole class just about this topic I'm not going to get into. Another one was in July of 2018. It was called Air, the Straight Truth on Thin Clouds. So you can look up some of those on Facebook and YouTube. They're both there. Classes that I taught and put all the stuff together so you guys can just, a quick hour and you'll know everything about chemtrails you need to know. Other than that, we discussed that in great detail in 2 other classes. Next, non-communicable diseases. Non-communicable diseases such as, I want you to get this. This is so great. This is so great. We covered this last time. I don't think anybody got it. Non-communicable diseases such as diabetes, cancer, and heart disease are collectively responsible for over 70% of all deaths worldwide. Read that again. And just look at that. What does that tell you? What do those 3 things have in common? Well, non-communicable says you can't catch it from somebody. So these are the 3 diseases that are taking down 70% of the population. What else do they have in common? Anybody? Have to do, yes, Janice. They have to do with your lifestyle. All 3 of those things. Taking down 70% of all deaths worldwide. Diabetes, cancer, and heart disease. They're preventable. Lifestyle modifiable diseases. Do you get that? This is the number 2 thing that the World Health Organization wants you to take into consideration. 41 million people. So this includes 15 million people dying prematurely aged between, wait. So that 41 million, almost half of that is people dying prematurely between 30 and 69. Interesting, huh? Over 85% of these premature deaths are in low and middle income countries, so the rise of these diseases has been driven by 5 major factors. Tobacco, physical inactivity, harmful use of alcohol, unhealthy diets, and air pollution. What did we just read about the first, top 10 was air pollution, right? Unhealthy diets. That is the only time you're going to see unhealthy diets in these top 10 things from 2019. That is the only time. These risk factors are also exacerbate mental health issues that may originate from an early age. Why? They don't say. Half of all mental illness begins by age of 14. Why would that be? What else is going on in the world right now that's raising awareness to this? Well, that can be, the shots, yes, but what else? What else happens with kids? What else is getting a lot of airplay not on mainstream media right now about kids? Trafficking is what I'm saying, trafficking. But most cases go undetected and untreated. Suicide is the second leading cause of death among 15 and 19-year-olds. That should tell us something right there. You know what I mean? Why is suicide not the number 2 thing? We're saying non-communicable diseases. Unbelievable. Among many things, the WHO will work with governments to help them meet the global target of reducing physical inactivity through such actions as implementing the active policy toolkit to help get more people being active every day. Good luck with that. But the big part of that is the first paragraph says over 70% of all deaths worldwide, right? So those are all lifestyle things. So if that's 70%, what's the other 30%? Who cares? Because the 70%, well, no, I don't mean you don't want to know, but it's 70%. Like, shouldn't we focus on the 70% that are killing? There's 3 things killing people. Right, right. It's like the logic of this kind of escapes me, and I'm not sure if maybe I don't know. Maybe I'm just thinking too clearly. I don't know. But these are all lifestyle diseases causing premature death, and little mention is made of where does the cancer, the heart disease, and the diabetes come from. You know, I said they're unhealthy, and you knew it. You already knew that, right? But why is there no mention of the etiology of some of these diseases? And when you've got 70% of the people dying, isn't everything else kind of minor? When you got 70% that you can hang your hat on as like the big deal, what's the rest of them? The other 30% doesn't even, it pales in comparison to the 70%, 41 million people. Come on. Okay, but then number 3 is the global influenza pandemic. And remember, this was January last year, right? Global influenza pandemic. The world will face another influenza pandemic. The only thing we don't know is when it will hit and how severe it will be. Global defenses are also as effective as the weakest link, are only as effective as the weakest link in any country's health emergency preparedness and response system. Well, if you go back and listen to some of the speeches that Bill and Fauci and those guys said, they knew what was happening. So who's constantly monitoring the circulation of influenza viruses to detect potential pandemic strains? They've got 153 institutions in 114 countries are involved in global surveillance and response. You still looking for your tax return? I mean, we got 153 institutions, 114 countries involved in global surveillance and response. But this thing, you're going to wear a cloth mask and protect yourself from a biohazard level 4, global murdering pandemic, right? But we've got all these institutions and countries involved in global surveillance and response of these pandemics. See, this guy was wearing a mask before it was cool. You know what I mean? Like, don't we have, this is 2 years old, that was long ago. See, this is now, you're living in current, what was it, September 28th, 2020, right? If you would 7 months ago, if I'd have said, hey, the whole entire population is going to be wearing masks, you would have called me a nutso, right? I never said that, thankfully, but look at this. Now it's common. You didn't even think about it. You just saw the mask on the dude's face. It's like, oh, yeah, all right. But every year, WHO recommends which strains should be included in the flu vaccine to protect people from seasonal flu? Yes, read that. In the event that a new flu strain develops pandemic potential, the WHO has set up a unique partnership with all the major players to ensure, with all the what? Why do they call them major players? Isn't that interesting? To ensure effective and equitable access to diagnostics, shots, and antivirals, especially in developing countries. So they're already telling you long ago that this is your salvation. So now, keep in mind, that was the first time out of the 3 right there, that was the global influenza pandemic. That was the first one out of all 10 that told you what the solution was. The solution was a shot. Let's go to number 4. Oh, and the CDC propagation of a new flu every year. That's a lie. I'll just go ahead and tell you. They name it for where they find it. There's not a new strain that comes out every year. That's a straight up lie. That is a lie. You're going to figure out what viruses, the whole realm of what viruses actually are here in a few weeks. So don't go anywhere. We'll talk about that too. If you have questions about that, we can talk after the cameras are shut off. Number 4, fragile and vulnerable settings. I'll speed through this one because we don't need to read all this nonsense. But check this out. The WHO will continue to work in these countries. Fragile and vulnerable settings, they're saying, were protracted crises, combination of challenges. You can scroll down, buddy. Drought, famine, fragile existings. Oh, we'll continue to work in these countries to strengthen. They're just saying that we've got a bunch of fragile settings that exist in all these regions of the world, and so that they're better prepared to detect and respond to outbreaks. How do you respond to outbreaks? Hold on. How do you respond to outbreaks? As well as to be able to deliver high quality. So these fragile systems, These fragile systems, fragile and vulnerable systems in settings where people don't have access to good quality, heavy duty, poisonous healthcare, right? We're going to make sure that we will continue to work in them to better prepare and detect and respond to outbreaks. How do we do on this last one? I don't know. Good question. As well as be able to deliver high quality health services, including, this should say vaccination, because vaccination and immunization are two totally unrelated things. You think they're the same thing because you hear them said the same way all the time, but they are not similar at all. You can become immunized to something with a paper cut, but you can only get vaccinated one way. You follow me? Your body is achieving immunity all day, every day. Vaccination only happens one way. So we'll get there. Oh, look, I wonder if they vaccinated the dog. Got to do the kid and the dog. Can't forget. Next one. It was a joke. Antimicrobial resistance. Oh, wait. I'm sorry. I'm stepping on your toes. You ready? Commercial break. Commercial break.
All right. So this person, we've read a few of her testimonials before. She has lots of victories to share. She says, I have been uncomfortable with my weight for many years. I came to Divine Design and found Dr. Spradlin was of the same mindset as myself, and I needed a little more help with accountability. Now, after maybe 8 or more weeks following my program, and sometimes not to the T, I'm noticing my clothes are fitting better. That I was in my closet the other day, trying on my clothes and feeling like I have a new wardrobe. Who likes shopping? For free. That's free shopping right there.
Free shopping. Free shopping.
And you have some memes.
It's kind of like when people come here and spin the wheel. It's like free shopping. Yeah. Only I'm not doing. Oh, you like that? I'm sure you do, Rob. We've got memes. Now, this is not meant to poke fun at anybody. We just like to have some fun every once in a while instead of all this doom and gloom. It's the longest game of cooties I've ever played in my life. Where's Base at? I don't want to play. That's new. I didn't see that one. Imagine, if you will, a virus so intelligent it knows the difference between a Walmart and a church. Yep, I love it. At the store, there was a big X by the register for me to stand on. I've seen too many Roadrunner cartoons to fall for that crap. I actually referenced this earlier when I said just make sure you don't stand on any X's. I referenced this not knowing it was going to be in here. But we just save this stuff. You keep saying that me not wearing a mask is killing you. It's been months. How much longer will it take? Okay. That was kind of inflammatory. I did not pick these, by the way. This is all Andrea's doing. Okay. I will throw you under the bus. No, but anyway, this is not a, exposing the lies, darkness to light class, but it is kind of going back and catching up on Healthline 2020, catching up on what we talked about in January and going ahead with part 2. Only the part 2 is very telling because I had Andrea do some statistic finding today, and you'll be shocked by this. So remember, number 4 was fragile and vulnerable settings, right? The one before this. And the solution was, what was the solution again? Shots, right? So 2 out of the top 4, the solution is shot. Everybody catch that? Number 5, antimicrobial resistance. So let's scroll down here. Drug resistance is driven by the overuse of antimicrobials in people, but also in animals. I'm just going to read this out loud, and when you get it, gasp. How's that sound? Especially those used for food production as well as in the environment. The World Health Organization is working with these sectors to implement a global action plan to tackle antimicrobial resistance by increasing awareness and knowledge, reducing infection, and encouraging prudent use of antimicrobials. You got it. Who was that? You got that? You hear that? Did you hear that sigh? See, that's how it just takes a second. It just takes reading the sentence, looking at the words. What's the problem there? Drug resistance is driven by the overuse of antimicrobials, but we're going to encourage the prudent use of antimicrobials. What else can you possibly do? And you can't make this up. This is their website. These are the people we're putting in charge. The industry that kills more babies is in charge of your health care. More babies die every day. It's a leading cause of death. And the industry that you put in charge of your health care is killing you, your grandparents, your aunts, and your uncles. Soft kills with the food and the air and the water, and then they get you to pay for the drugs with your hard-earned money, and you get a $4 prescription cost, and you think you made out like a bandit, but you only paid 20 grand to get there. That's how sick these people are. I'm just telling you. So see, they put it right under your nose. How could you not see that? What else are you going to do with antimicrobials? What else is there? You know, there's already people saying that we live in medicine. We live in the post-antibiotic world in medicine, where antibiotics will do no more good. You do that, medicine's hogwash. Medicine's done. Medicine is done outside of an emergency surgery. But here's the kicker too. With all of the transhumanism coming, I mean transhumanism, not transgenderism, but transhumanism, where man is merging with machine. You put AI, you put Alexa, you put Siri in charge of your healthcare. All right, that's what's happening. There are 3 doctors that are going to go bye-bye first. Your pharmacists, your radiologists, and your surgeons. Those are the top 3 doctors that will go, because medical error, and you know, you can't, a robot's not going to count your pills wrong, right? And a robot has more precision than a person's hands, apparently. I don't know if I totally 100% believe that or not, but there'll be less error, you know? And radiology, I mean, you know, cyborg's eyes can see differences in shades on a screen when you're looking at an MRI or a CAT scan. These are legit, you know, scientific things out there where people are really legitimately saying these are the careers that are going to go bye-bye, right? Some of these careers are going to go bye-bye, and within medicine, it's those, as far as doctors go, those are the top 3. Those are the top 3, so just be aware of that. Number 5, Ebola and other high-threat pathogens. Before we even read this, what do you think the solution's going to be? Have you found a pattern yet? Jonathan's got it. Yeah. Well, do you see the pattern here? We're only on number, what is this? We're only on number 6. And 3 of them have been more drugs already. The solution, more drugs. And this is your World Health Organization. Let's read. Ebola. The watch list, this watch list for priority research and development. So you can call it scrolling down. Where is it? At a conference on preparedness for public health emergencies held last December, participants from the public health, animal health, transport, and tourism sectors focused on the growing challenges of tackling outbreaks and health emergencies in urban areas. How do you tackle an outbreak? Come on, you haven't seen any zombie movies? What happens? What do you do? Huh? They quarantine, and then they're coming with a, what's the fix in every zombie movie? Oh, what's the fix? You've been programmed. Yeah, you know. What's the fix? Everybody knows. The program, the only way you're getting out of zombie apocalypse is with a vaccine. That's the only way. So whose research and development blueprint identifies diseases and pathogens that have potential to cause a public health emergency but lack effective treatments and shots? This watch list for priority, see, you're being told there's only one way out. There's only one way out of this, right? This watch list for priority research and development includes Ebola, several other hemorrhagic fevers, Zika, Nipah, Middle East respiratory syndrome, coronavirus, MERS, CoV. Nobody had seen that. Well, coronavirus, there's tons of them. But see, back then, nobody knew about it unless you had some microbiology or some, you know, training. You never heard of a coronavirus unless you'd been to school for stuff like this, right? So MERS, CoV, and severe acute respiratory syndrome, SARS, and disease X, which represents the need to prepare for an unknown pathogen that could cause a serious epidemic. What do you think when they find disease X? What do you think the fix is going to be? How do you know? There's a pattern. You see what I mean? See where I'm going? So this here, Ebola and other high-threat pathogens. Well, let's just see what the next. Let's see what the next fix is. Let's go to this link to the genetically modified mosquitoes, because we talked about this a few weeks ago. We talked about this. Where does Ebola? Where's all this stuff coming from? Dengue fever, Zika, all this stuff. West Nile, yellow fever. What does it come from? What?
Labs.
Say what?
Labs.
Well, that can be right. But check this out. Study on DNA spread by genetically modified mosquitoes prompts backlash. You noticed all of those things in that paragraph that I just read you there. Most of those things are mosquito-borne pathogens. But now, keep in mind, this was a year ago. Study on DNA spread by genetically modified mosquitoes prompts backlash. For 10 years, the company Oxitec has been testing whether genetically modified mosquitoes can suppress populations of their natural brethren, which carry devastating viruses such as Zika and dengue. So let me get this straight. All the diseases that are carried by mosquitoes, we're going to fix them by genetically modifying the mosquitoes. See where I'm going with this? Like, this is the stuff you're reading that nobody questions. Nobody thinks about it. The one critter on the planet that could mess up more people than anything, well, let's just go ahead and play with their chromosomes. What could possibly go wrong, right? Now a team of independent researchers analyzing an early trial of Oxytec's technology is raising alarm and drawing mire from the firm with a report that some offspring of the GM mosquitoes survived and produced offspring that also made it to sexual maturity. As a result, local mosquitoes inherited pieces of the genomes of the GM mosquitoes, the team revealed last week in Scientific Reports. That's all I want to read, because now we got Franken mosquitoes.
Why don't they put a cure in this?
That's not, no. See, you're thinking, no. Next one, the link to GM mosquitoes. She said, why don't they put a cure in the mosquitoes? There is none. See? That's the problem. Let's go to the next one here. Genetically engineered mosquitoes. Here's another article from just a little while ago. You know, well, this was like 8 years ago, but they were talking about this 8 years ago. It's genetically modified mosquitoes, folks. When was the last time you heard about it? Check it out. Dear Earth Talk, I couldn't believe my ears. Genetically engineered mosquitoes, why on earth would they be created? And I understand there are plans to release them in the wild. This was 8 years ago. They just released them in the Keys, what, a month ago? Yes, it's true. GM mosquitoes, bred in the lab to transmit a gene during the reproductive process that kills their offspring, have already been used on an experimental basis in 3 countries, Cayman, Malaysia, Brazil. See? To counteract the quickly spreading mosquito-borne viral infection of dengue fever. See, so we've got an outbreak of a mosquito-borne viral infection, so what do? We play babysitter with the mosquito's DNA. See, this is just the most stupid thing. You know, we don't mess up our own health enough. Why don't we go play with the insects? You know, the World Health Organization estimates that many as 100 million cases of humans infected with dengue fever. If they were doing this 8 years ago, could they have been doing this before that? So could some of these diseases be an outbreak from something else? Could some of these have been planned? Oh, I don't know. I mean, we're genetically modifying humans now. Everyone seems to be let that cat out of the bag quite a while ago when we did the sheep 30 years ago. So it's kind of interesting, isn't it? You think this is all? You think they're just figuring this out? I doubt it. Which causes a severe what kind of illness? Huh. It's been in the news a little bit since January, since the last time we talked about this, and can in certain instances be fatal, occurring annually in more than 100 tropical and subtropical countries. We won't read the rest of this, but just wanted to put that out there. And let's watch the next link here, that short little video. You want to watch that again, Jonathan? Is that creepy? The Mosquito Week one? Should we check this out? I think it's time to creep everybody out a little bit. I think it would be. Don't you think it's a creepy time? I mean, we're coming up on
October, yeah.
We're coming up on October. I mean, yeah, it's the Mosquito Week. Well, and see, people think it's all conspiracy. No, it's not conspiracy when the people are sitting there telling you in a filmed interview, sometimes in front of hundreds of people at a TED Talk. It's not a conspiracy if they come out and tell you what they're doing. It's a conspiracy if you don't listen. So let's check this out. Oh, yeah. You guys will love this. We watched it a couple weeks ago. Check it out again. It's Bill Gates' YouTube channel. Isn't that wonderful? That's Bill Gates' YouTube channel. That's his most recent, as last I knew, a couple of weeks ago, when we first put that class together a couple of weeks ago. What was the name of that one? That was actually one of the Darkness to Light classes. But Bill Gates' YouTube channel, talking about, he has this video where he's talking about, we're going to biologically engineer all the mosquitoes, and then we're going to turn them loose in Florida, and then here's what's going to happen, and we're trying to save people's lives, and blah, blah, blah. And that was the video on his YouTube channel, advertising Mosquito Week. Would you buy a ticket for that ride? Isn't that crazy? Isn't that crazy? Going on. Oh, and just so you know, I'm not out of my mind. Click on that natural blaze thing, just so that you know I'm not totally out of my mind. I am, but not totally, quite yet. But you wouldn't know if I was lying, would you? Am I lying? I don't know. Let's just check this out. Maybe I'm crazy, I just don't know it. Check this out. Because it's the Natural Blaze. So the Gates funded company, you'll see this article here in a minute about, yeah, we'll just read it. We'll just read it because you can't make this up. And this is easy stuff to find. These are not any conspiracy websites. These are just easy, like, hey, just type in Bill Gates and mosquitoes and just look what comes up. Gates and military-funded mosquito vaccine delivery, plus Gates-backed company to release GM mosquitoes. This is June 9th. It's a couple months ago. Okay, let's just check it out. Just in case 2020 wasn't whacked out enough, the EPA recently announced rolled back regulations for companies due to the coronavirus outbreak, paving the way for companies to skirt environmental laws and regulations during this declared crisis. Skirting environmental laws, like maybe, I don't know, 3 states burning down and, people are lighting crap on fire, but we're calling it global warming, so you have to pay more taxes. Isn't that great? So it should come as no surprise that Oxitec, same company you just read about in the other articles, a biotech company funded by who? Is moving forward with a failed 2018 agenda to release GM mosquitoes into Florida and Texas. This is what you just heard about happening a couple weeks ago. All the keys and the stuff happening down in South Florida, they were releasing the stuff. In times of crisis, rollback regulation, we have to ask the question, who's ensuring public safety? The report also explores research funded by the Gates Foundation in addition to the DoD, Department of Defense, and the National Institutes of Health with mosquito-delivered vaccines. So flying syringes, that's what's coming for you. So, my friends, if you are not already planning on raising your health to a level where this crap won't get through the proverbial screen door and hit you in the face, if you're not already planning, like, you're already 10, 15 years behind, and in order to turn this Titanic around in your life, in order to turn around your health, you have got to start immediately. So if you are not already doing something to cut down the toxins and the viral load and the crap food and the things that you're eating and being sprayed on you and out of the ground and toward you, you go to a hotel and they're with the little, hand sanitizer. That's 30, 40 chemicals. How about your makeup? How about your toothpaste? How about this? How about all that stuff your body has to fight off? Then you take drugs, and then you smear on some suntan lotion or some sunscreen. You're dealing with an increased number of assaults to your body every day. And then they're going to dump GM mosquitoes in your face. Are you going to survive, or are you going to be the first wave in the ground? You follow me? Do something now. Do something now to get your health up. Number 7, out of 10, weak primary health care. What did we just talk about? We just talked about how wimpy, a lot of the health care is for a lot of people. They're just getting killed. Check this out. Primary health care is usually the first point of contact. Remember, this is the top 10 global health threats, as according to the WHO. Okay, primary health care. It says weak primary health care. It's usually the first point of contact people have with their healthcare system, and ideally should provide comprehensive, affordable, community-based care throughout life. Ideally should. What does that tell you that it doesn't provide? It implies that there's no comprehensive, no affordable, and no community-based care throughout life. Is that not what it's saying? Primary health care can meet the majority of a person's health needs of the course of their life. Health systems with strong primary health care are needed to achieve universal health. A third grader could have written this. Yet many countries do not have adequate primary health care facilities. The neglect may be a lack of resources, but possibly it's a low focus in the past decades on single disease programs. So the WHO hosted a major global conference in Kazakhstan at which all countries committed to renew the commitment to primary health care. The WHO will work with partners to revitalize and strengthen primary health care in countries and follow up on specific commitments made during this declaration. So what is this telling you? People's confidence in a healthcare system is already pretty low. Okay, this is number. Oh, hold on. We'll do a commercial break right here on the piggyback of this one.
Yes.
This is a good time right here.
All right. So this is another patient that we've had a number of victories from. He said, my acid reflux required me to sleep on an incline wedge pillow. So in other words, he couldn't just lay down and, sleep normally. When asked, how are you now? He said, I sleep on my back without snoring and without acid reflux and without the wedge pillow. I bet his wife's happy about that.
Who's really, really happy about that, though? You are correct. Oh, I've got memes. Let's go to meme land real quick. Funny stuff. All right, let's go to meme land. Oh, this is my favorite. This is a good one. And these don't always have to be about Corona, but I guess since we're in that time, let's enjoy the last few weeks of Corona before the election, right? So here's MMR with, that's not really me, okay? That's not really me. This guy just laid out, you know what kind of courage that would take to like jump over a charging bull? Look at that. That has to be photoshopped. It's unbelievable. And he's got Nikes on, so that should tell you. He's just doing a swan dive over the bull. That's just hilarious. Okay, that's just one of my favorites. I've never seen this one before. When you haven't caught COVID and you realize not even a global pandemic wants you. Aww. What's his name? George? George. Poor George. Why haven't I seen these? Why are all the humans wearing muzzles? I haven't even seen these. These are great. That's hilarious. COVID-19. Feeling great. Yeah. You guys threw in some doozies on me. I never saw these. Okay. Now, for the first 5 or 6 that we went through, you saw the solution was what? Correct. What's the solution to this one? Shots. This is, remember, top 10 global health threats. This is vaccine hesitancy. This is number 8. Let's read the whole thing. Let's just see what they say. Vaccine hesitancy, the reluctance or refusal to vaccinate, despite the availability of vaccines, threatens to reverse progress made in tackling vaccine-preventable diseases. Vaccination is one of the most cost-effective ways of avoiding disease. It currently prevents 2 to 3 million deaths a year, and a further 1.5 million could be avoided if global coverage of vaccinations improved. I'll keep reading. Measles, for example, has seen a 30% increase in cases globally. The reasons for this risk rise are complex, but not all of these cases are due to vaccine hesitancy. However, some countries that were close to eliminating the disease have seen a resurgence, or you would call that 6 people getting it, and all of a sudden it's a massive outbreak, is what the media turns it into, right? The reason, mostly among the vaccinated population, by the way. I'm not going to turn this into a vaccine class, but I just want you to see how heavy-handed this is. The reasons why people choose not to vaccinate are complex. A vaccines advisory group to the WHO identified complacency, inconvenience in accessing vaccines, lack of confidence are key reasons underlying hesitancy. Health workers, especially those in communities, remain the most trusted advisor and influencer of shot decisions, and they must be supported to provide trusted, credible information on vaccines. If you haven't seen through the craziness that's been going on in the last 7 months with all the shot stuff and all the people fighting back and forth, and if you haven't witnessed who's making the money off of all this stuff, you need to look into this. This is huge. This is the WHO's top 10 global health threats. And number 8 is vaccine hesitancy. What have we not seen? Just think of some of the things that you think should be on this list. Top 10 global threats to health. Think of some of the things. We're going to cover that in a little bit. But in 2019, the WHO will ramp up work to eliminate cervical cancer by increasing coverage of the HPV vaccine. What's that called? Anyone know? HPV is called Gardasil. Yes. Among other interventions, one of the most dangerous shot there is, by the way. Be here next week when we have a guest speaker who was damaged by Gardasil, and she will speak. She's 30-something now. Yeah. So, she'll be here next week, and we're going to have a little panel discussion with her when we show the movie, actually. 2019 may be the year when transmission of wild polio virus is stopped in Afghanistan and Pakistan. If you saw my class from last week, you know that that's not the case, what we talked about with the wild polio. So last year, less than 30 cases were reported in both countries. So look at that. 30 cases were reported in both countries. We're going to wipe it out, those 30 cases. You can't make this up. It's right there in black and white. It's right off their website. They sound so heroic, but they're not. Right? The WHO and partners are committed to supporting those countries to vaccinate every last child to eradicate this crippling disease for good. Because you know polio will only attack children. You know that, right? I'm joking. You can laugh, you can sigh, you can guffaw at that. It's unbelievable. I'm being very sarcastic. So vaccine hesitancy. Let's check this out. Check out this link to the New Jersey vaccine religious exemption vote from last week. Now remember, we did this class back in January. So I said this was a week ago. It was about January 20th when we did it. So New Jersey vaccine bill to end religious exemptions fails, but debate rages on. We don't have to watch the video, right? Oh yeah, this guy here, you've seen this guy. You've seen that face a few times during this whole thing that's been going on. We don't have to get right into this, right? It's a video we don't have to watch right now. But this was something that happened in January, second week of January. New Jersey vaccine bill to end religious exemptions. New Jersey was trying to get rid of, you only have three. You've got medical, you've got religious, you've got philosophical. New Jersey was trying to get rid of religious. If they get rid of that, guess what? All the rest of them are going soon. They failed, but there was a lot of people on, if you were here in that class, they failed, but there were hundreds and hundreds, if not thousands of people on the steps of the Jersey courthouse yelling and screaming like concerned moms. Educated, yes, educated mothers, educated people who were looking at this going, no, we're not giving up our religious exemption. So, oh yeah, I forgot this was in there. Check this out. This is the vaccine hesitancy. Just pull it up on Wikipedia, see what it says. That's all we're doing. We're just pulling it up. I don't recommend Wikipedia for factual stuff, but let's just see what the most of the population would read about vaccine hesitancy. Also known as anti-vax is a reluctance or refusal to be vaccinated, to have one's children vaccinated against contagious disease, despite the availability of vaccination services. It's cut off a little bit. It's still cutting off. Yada, yada, yada. Yeah, forget it. No big deal. But you can look up vaccine hesitancy. Would that be the number 8 thing in all the world that would be a global health threat? I don't know. You tell me. We can skip the, let's just take a look at the big bad cough, the GlaxoSmithKline. We don't have to watch this video, but let's look at this picture. I saw this one time. I was speaking at a medical place. Let's just look at the picture. The slide, actually, with the big bad wolf. We showed this last time. And so I find this to be strikingly demonic. It's making, who's this working on? What's this doing? Who's this working on?
Get rid of the old.
Well,
The heartstrings of parents and grandparents.
pulling the heartstrings of parents to make them afraid of who? The elderly, the grandma, the grandpa. So no, you can't be around my kids if you don't have a diarrhea vaccine and an acne vaccine and a gout vaccine and all this other nonsense, right? Grandma, what a big whooping cough you have. See, with the advertisements, they're turning the parents against the grandparents. Isn't that crazy? And grandma is dressed up. It's everybody's worst fear. What was your worst fear when you were a kid? Monsters, big bad wolves, right? Little Red Riding Hood. They're going right back to your child, your psyche as a child. They're going right back to it. They're going, whoa, yeah. Grandma's the big bad wolf. Isn't that horrible? I saw that speaking, and when I was at a place speaking, and I thought, wow. I took a picture of it. I couldn't believe it. I wish we could read the rest of the stuff here. Anyway, let's keep going on. So, well, let's not even talk about Bill Gates. We showed the vaccine thing or the shot 2 weeks ago. Let's just get right into number 9, dengue fever. Remember what was I think it was number 6 or number 7. Remember how was dengue fever spread? Mosquitoes. Well, it's a mosquito-borne disease that causes flu-like symptoms and can be lethal. I got an idea. Let's genetically modify the mosquitoes. And that way we'll never know what's going on with yellow fever, dengue fever, Ebola, any of this nonsense. High number of cases occur in the rainy season of countries in Bangladesh, such as Bangladesh and India. Now its season in these countries is lengthening significantly. The disease is spreading to less tropical and more temperate climates. An estimated 40% of the world is at risk of dengue fever, and there are around 390 million infections a year. Whose dengue control strategy, if you click on that, don't do it, but if you click on that and go read their control strategy, what's their control strategy? Correct. Number 10, let's go to HIV. The progress made against HIV has been enormous in terms of getting people tested, providing them with antiretrovirals. 22 million people are on treatment. We won't go into that. And providing access to preventive measures such as pre-exposure prophylaxis. You've seen the commercials on TV. Two dudes going out to the bar and they prep up so that they don't. It's a self-protection against AIDS, against HIV. So when people take, and you see the billboards on the highway. There's PrEP billboards on the highway. However, the epidemic continues to rage with nearly 1 million people every year dying of HIV/AIDS. Since the beginning of the epidemic, more than 70 million people have acquired the infection. 35 million have died. Yada, yada, heartstrings down here. This year, oh, wait, hold on. So the solution to the last one, dengue fever, the solution was what? Here, the solution is what? Drugs, or antiretrovirals, which are drugs. So out of the top 10 global health threats to the WHO last year, 8 out of 10 are solved by more drugs and more shots. One of the threats was being not in on it with drugs and shots. And one of them, I think, was all the other stuff that kills people, like non-communicable diseases. Did everybody track with that? Like 8 out of 9 had to do with shots. Your solution is a shot, right? So let's now check this out. Things that did not make the list. Why are we talking about all this? This is your healthcare. This is like the future of your healthcare. I'm here to break the bad news to you. The future of your healthcare is not good. Let's look at the next thing. What didn't make the list? Or no, is this a slide?
Yeah.
Okay. No mention of the opioid crisis. And here, Andrea, you want to write some numbers down? Write down the how many abuse facilities are in the U.S.? Let's just play a game here.
Want to take a stab at it?
Take a stab. I'll read some things. You guys guess some numbers. How many abuse facilities just for opioids are in just the United States? This is your healthcare. Isn't this happy? Say what now?
500? 132.
52 states, so that'd only be 10 per state.
Yeah. That's a good point.
States are
How many abuse facilities in the U.S.?
3 per city.
How many abuse facilities? Answer is 14,000.
Wow.
Divide that by your number of states. Does that tell you there's an opioid crisis? Crazy, huh? And that's 14,000 plus abuse facilities in the U.S. 1.27 million Americans using prescription opioids for pain. That's almost 68,000 deaths in 2018. But that did not make the list here. But, a disease that took out 20 people in 2 countries, and that's one of the top 10 health threats. I'm telling you, you're being lied to. I'm telling you. If you're believing these crackpots, you're out of your mind. Next, death by legal drugs. Anybody want to take a stab at it? Take a stab. Anybody? Death by legal drugs. Per year.
Your best guess.
75,000.
Oh, come now, Janice, you know better than that. You've done this a long time. Death by legal drugs per year. Anybody?
30 mil.
Per year.
Per year. Per year. I mean, our country's only 330 mil.
Only in our country?
Probably, yes. 490,000 people since 2001 due to properly prescribed meds. Remember, 3,000 people died 9/11. This is since 2001. Statistically in 2001 too, the STAR report came out, and that was where they were basically saying every year there's 200 to 250,000 people that die by medical error, and some of that is that's each year. This right here, I'm not sure if that was America only.
Yeah, it was.
Yeah, since 2001, by properly prescribed. And all of these things, you can find these government websites, you can find these in medical journals, you can find these in newspapers, they're everywhere. So we just took, some of these stats you can probably find in different places under different categories, different.
Just a quick 2-minute search.
Quick 2-minute search. Next, how about a cancer epidemic? Cancer was never mentioned in there, except the non-communicable diseases, right? Did they say anything about like fixing the water supply in Africa? Did they say anything about fixing food, teaching people how to grow food? Did they say anything? It's interesting, the things they left off, isn't it? Very interesting. Cancer epidemic. In 2018, how many people died? 600,000 in 2018. Second leading cause of death in the U.S. We've got hospitals that are focused solely on children with cancer. Solely. We've got whole entire hospitals that's all they treat.
Which normalizes it.
Totally normalizes it. Nobody asks that. Nobody asks that. What are they feeding the kids? What are they giving? What are they drinking? What are they eating? What are they wearing? What are they popping? Because the fix is chemotherapy and radiation, right? Next, number 4. Now, we discussed that the vaccine injury thing. Vaccine injury, was that in there? No, 8 out of 10, the solution was more shots. Vaccine injury.
That was probably in the movie Vax, too.
Big part of it, yeah. So, U.S. Vaccine Injury Compensation Program, as of December 2018, keep in mind, one drug will garner a pharmaceutical company hundreds of millions of dollars. Hundreds of millions of dollars, okay? If not billions per quarter. Some drugs can get up in the billions. This right here, since 2018, as of December 2018, this is what the U.S. Vaccine Injury Compensation Program has paid out to injured vaccine
These are just the ones
people.
that counted as qualified injuries.
These are not every person that said they got, these are that went through the whole vetting process, the whole vaccine injury court, which is a kangaroo court that's set up by the vaccine makers. $4 billion, which is a drop in the bucket. But it didn't make the list, I found. Childhood sickness and obesity. Let's look at the numbers on this one. Childhood sickness and obesity. How many kids, what percentage of kids in the U.S. are considered obese?
Probably 60%.
What percentage of kids? Anybody?
80.
I would go with you guys, but the stats we found was 18.5 of U.S. kids are obese, 18.5%, which is about 14 million kids, which means the non-communicable stuff that we talked about, the cancer, the heart disease, the diabetes, what's going to be on their horizon? Crazy, huh? Next, not enough timely genetic manipulation in humans. We didn't mention that. Let's keep going here. Next slide. What didn't make the list? We didn't have enough suppression of natural health or alteration of search engine results. Right? We didn't have top 10 global threats to health. We didn't have lack of censorship against mainstream doctors. We didn't have that. Oh, not enough dead natural doctors. We didn't have that in there too. We need more dead doctors, dead natural doctors. That's what we need. In class we did a couple weeks ago, how many of you were here? Deadly ducks, done dirt sleep, right? And then application of GRIN technology, I'll discuss this in a minute, to accelerate the acceptance of transhumanism, not progressing rapidly enough for human survival. Applications of genetics, robotics, nanotech, and transhumanism. That's what all of this is going into, GRIN technology. We'll talk about that much later. We talked about it a little bit in the 5G classes that we did. Check those out on YouTube and Facebook about the 5G stuff. GRIN technology. So we didn't have, what didn't make the list? Top 10 threats to global human health should be that we just don't have enough applications of all this technology going fast enough to ensure our survival. That's what the problem is. Next. We didn't put down that Amazon is exposed for selling drugs and fake or expired supplements. This has been going on for years. I've been in practice 7 years, and there's been fake supplements and fake drugs and all kinds of stuff that's been implicated online in many places. CVS, Rite Aid, Walmart, Target, they all got busted for selling ground-up houseplants, is what it was. Ground-up houseplants, and people are always like, well, supplements don't work. Yep, you're right. If you buy them at Walmart. The CVS, that's why nothing you see here you will find on a shelf anywhere in any store. This is all doctor-only stuff. So this right here, they didn't mention that, millions of people getting the wrong stuff could have been a global health threat. I don't know. I just sat down and thought of stuff for 5 minutes and thought, it's interesting, like when you read the Bible, you read it for what it says, but then you notice some of the things it doesn't say. You go, it could have said this and this and this. Interesting. Amazon could have been there. It could have had, what didn't make the list? Top 10 global threats to health could have been all these, conspiracy theorists taking their supplements. It could have been on there. It wasn't. Google merging with Big Pharma too slowly. That's a joke. You can laugh at that. What didn't make the list? Not enough censorship of natural healthcare pseudoscience. We need to shut down these quacky chiropractors who think that you can fix everything with pushing bones and pushing arms and telling people how to eat and giving them supplements. That's just hogwash. Your body's not made of what you eat. All right, that's it. Other than that, I want to show you some personal screenshots coming right here. I just want to show you, speaking of the censorship and everything, it's a Facebook group, Tennessee Coalition for Vaccine Choice, not anti-vax, vaccine choice. If your kids are younger, and I'm sorry, buddy, I'm trying to stay out of your way. If your kids are younger and you want to do a delayed, what do they call it? Delayed, slowed down schedule, or if you just don't want to do any at all, or if you've actually, educated yourself and read the contents of what's in some of the stuff, and you decide that you don't want vaccines, this is the place for you. You can go to one of these groups. There's millions of them. But look, when you try to join it, this was months ago. This was back right when everything hit. This group discusses vaccines. When it comes to health, everyone wants reliable, up-to-date information. Before joining the group, read information from the CDC that can help answer questions you may have about vaccines. And you can click here to go to the CDC and read the real information on vaccines, is what they're saying. Or you can still join the group, or you can just cancel it. But now they're kind of monitoring what groups you join and telling you, hey, are you really sure you want to join this group? You've got better information about vaccines over on CDC website. You see? Everybody get that? Have you all seen messages like this? No? You'll see them. It is. You'll see them. You'll see them more and more often. This was January. This was practically happening. This probably happened in December. And a patient sent this to me. Said, hey, check this out. Look what they're doing now. Interesting, huh? This was before the corona thing hit. This was December, maybe January. Let's go next. Oh yeah, I've been slammed a few times for false information found on Divine Design Natural Health. Check this out. Mike Adams, who's one of the biggest geniuses out there, he runs his own laboratory, he does his own everything. The guy's a genius. Falsely claims cancer genes and the entire genetic code. I don't even know what this was. I never posted anything about Mike Adams falsely claiming. I think it might have been a video in another thing, a video within a video, if you know what I mean. I don't know what this is, but that was my first fact check. There's been many since then. Huh?
We've had a few since.
Oh, we've had many since, but that was the first time I thought, wow. The fact checkers never started until some little droplets of truth started getting out. Very interesting, huh? Mike Adams, to fight false news, Facebook reduces the distribution of misleading content while also showing additional reporting on the same topic. Who's judging what's fake? Right? Pages and websites that repeatedly publish or share misleading content will see their overall distribution reduced, their ability to monetize and advertise removed, and their ability to register as a news page removed. People will also be able to see if a page has a history of sharing false news. Deleting the misleading content won't affect these outcomes. So once you get fact-checked, you can't go back, right? Let's go to the next one. I forget what some of these are. These are some things. Oh, this is a friend of mine right here. Life Spa Chiropractic and Wellness, Dr. Esther Jimenez, has some restrictions, including reduced distribution because of the sharing of false information about vaccines. So this was something that popped up on her. Somebody was getting information on her site and sent this on her Facebook page and sent this to her, I believe, and she posted it. So one of my friends she's also a chiropractor and does a lot of nutrition. So it's you could talk about all kinds of stuff, but just don't mention those vaccines. Don't talk about false information about vaccines. Don't talk about that. Next. And help for headaches and sinus congestion. Oh, I saw this one time. This ad isn't running because it asks a direct question to or makes an assumption about a user's personal attributes. For example, don't let a cold get you down, or are you a cancer survivor? This type of language can feel like an invasion of a person's privacy, which is something we strive to protect. Right? You can't even talk about headaches and sinus congestion. The ad can't run. This isn't us, thankfully. I mean, not yet, but the ad can't run because they're saying something like, are you a cancer survivor? It gets into people's privacy. For a better understanding of this nuanced policy, we strongly urge you to read our advertising policies. Hey, it's their page. They can do whatever they want. Next. I mean, they don't think that you're getting all this for free. I mean, they're harvesting your data. You're not just using their platform for free. I hate to tell you. Chiropractic, oh, this is a group that I'm in, or was in. I'm not sure whatever happened to it. Just had someone try to join the chiropractic cash-only practice group and was presented with this before they were allowed to join. This group discusses vaccines. If you want real information, go to the CDC website. So they're preempting anyone who goes to your site now. Preempting anyone, or they can preempt anyone who wants to join your vibe. Next, I think that's it. Or are we getting pretty close? Oh, yeah. We got rid of the name. I don't know where this is from, but I'll read this. Can you blow that up a little bit, man? You got to see this. No, we can't? Okay. Shoot. Well, you can probably... Can you see what's on the... Our kids love getting their flu shots. They start asking for them in the summer, all because Publix gives them a $10 each gift card, and we let them go wild. It's hilarious to see what they get. They get a $10 gift card at Publix for getting a jab. Huh?
That's hilarious.
It's hilarious to see what they get. Well, yeah, here's the funny thing. If you zoomed in on that, that's like cake mix. That's some kind of crap cookies or something. Looks like a shake or some juice. Oreos. Looks like Pop-Tarts and stuff. A bunch of candy and stuff. I'm not making fun of anybody's family. I'm just saying they give you a shot for free, then they pay you.
The kids are wanting it, like they're asking for it.
Yeah, because they
Right.
get all their
Right,
$10.
right. Get them hyped up on sugar, right? That just breaks my heart. I forget who sent that to me, but somebody.
Somebody, a friend from Alabama posted a picture almost exactly like it.
Yeah. So you're proud of getting your kids the flu shots, and they got $10, and they went and put another nail in their own coffin with the crap food. I'm not making fun of anybody's family. I grew up worse than this. Okay, I had teeth falling out of my face. I had allergies so bad I had no skin left. So I ate crap like this all day long, but I didn't know. And I got sicker and sicker and sicker and sicker. Then I get older and I realize, wow, your food has everything to do with how fast your body replaces itself and how long you live. Why was I never told this? It's so simple. So those top 10 threats to global health, those are not your top 10 threats to global health. Those are a very small level of minutia in the whole scheme of things. But the one take-home message from all of this is if you have done nothing to get your health up to a certain level, start now. And if you're up here at a certain level, go higher. Because the stuff they're going to dump out of the planes and the stuff they're going to pump in the water and the stuff they're trying to pump in you knows no end. It knows no end. So if you want to live sick and if you want to die young, put your health care in the hands of another third-party person who cares only about profit. Put your hands in the policies of Blue Cross Blue Shield, Humana, Aetna, and Cigna, and we'll see how it works out. Because the people I know who have the best insurance are the sickest people on earth. Yeah. All right. Now on that note, got any memes? No? There should be a couple. So we don't want to throw anybody under the bus, but that's just... oh my goodness, we can't infect you because mask. Mask. They are wearing it upside down. Yeah. Yeah. I don't know how you get a zombie to wear a mask. Yeah, it's much like having a kid wear a mask, I guess. Yeah. Anything else? Is that it? All right. So what do? You, first of all, have to realize that you've got somebody like this in your back pocket. You've got somebody here in your town. Then you have to start making the right steps towards changing things. Change up your diet, change up your food, understand what's in the air, what's in the water, what's in the food. It doesn't take a lot. You don't have to read every website. Please don't read websites. Please do not. Please do not use Dr. Google to try to figure out what you have. It will lead to two things: fear and a wrong diagnosis. That's it. It will just lead you down a path. I know people come in here, they spent two days all over the weekend trying to figure out what was this little boil they had on their backside, you know, and it's a stage 4 melanoma, they just know it by the time you walk in. You know, they've already diagnosed it, they're skitzed out, they're crying, they're ready to sign up, you know, they're ready to redo their will, you know, just because of something they read on Google. And it's horrible. It's horrible. It is so bad. So don't research this. Let us do it. Let us just come here. We've handled bigger, badder stuff than you've ever brought us, I promise. And get in here and get better. And instead of spending $5 and $8 and $10 and $1,200 on a CAT scan or an MRI just so you can somebody look at it and go, well, it all looks good to us. Instead of put the $5 or $8 or $10 or $1,200 into supplements that will replace your body's moving machinery. Does that make sense? Instead of paying someone to cut your heart open and to stuff a bunch of mesh in there, why not buy some supplements that are made of heart, not human, animal heart, that will help replace your heart the way it was always meant to be replaced in the first place. Does that make sense? Tribesmen drop a buffalo, they eat the buffalo, they eat the whole thing. They suck the marrow out of the bones, they go home, they take everything. Yo, here, take some eyes, take some kidneys, take some intestines. So all the people in the tribe would benefit from that animal, right? Nothing would go to waste, right? We don't do that anymore. It's been 100 years since we did that. It's been over 100 years in many places that we've done that. That's what these supplements have. You can use homeopathic stuff, you can use herbal stuff, you can use whole food plants and animal stuff. You can use stem cells, we've got everything. We've got detox ways to hurry up and get all of this nonsense out of your body. All the stuff you've been hopped up with for years. Go do a foot spa, do a sauna, do pulse electromagnetic field therapy. We'll do a tour here for people who've never been here before. We'll show you what's going on. And then that way you can expedite and speed up the process of your body pushing all this stuff out. Have you been on drugs for 25 years? Good. You need some of this detox. Have you been eating crap food for 10, 15, 20, 30, 40, 50 years? Good. This is the stuff you need. Have you been not only not eating good food, but eating bad food, plus going outside and getting dosed, plus sitting next to a power line, plus eating a bunch of drugs, plus getting your yearly flu shot? Good. We're the right place. You can come and speed up the whole process of getting that crap out of your body with all the stuff we do here. Chiropractic, nutrition, laser, detox, sauna, pulse therapy, all kinds of stuff. What am I leaving out? All kinds of stuff. So, any questions before we sign off?
Yeah, what kind of shot could lead you to a type 1 diabetes?
What type of shot could lead to type 1? We'll discuss that after we shut the camera on. Anybody else? That's a good question.
I have if it's a question or a comment.
Mm-hmm.
If all the powerful people in the world doing all of this,
Give him a microphone, please.
all the powerful people in the world doing all of this,
Mm-hmm.
they prevent themselves, or you think this is more a satanic way or lying to them and they doing that to their own selves? They doing that to the whole world.
Well, it depends on which people you're talking about. There are people who don't believe they're humans and that they're above all this. And then there are people who
Or just say the governing body, saying like
Yeah.
whoever the governing body is, that's what I always call them, that's putting this out there, that's, and, creating the sicknesses. What are they doing? Are they subjecting themselves to
Yeah, I get that. There are some people who, they have their own chefs, they have their own stuff, they know what's going on. Like the certain politicians, they're not eating the same food you're eating. They know what's going on with the water. They know they're not outside gathered around in the stuff, dancing in the chemtrails. So there are those people who avoid it just by living in their cloistered little cells, and they have their own chefs and they have their own stuff. And then there are other people who don't bother even worrying about it because they don't think they're human. But they are, but they don't see it that way. So how can they, so your question, I guess, is like how can they do this without themselves making themselves sick? They are to a degree, but they're depending on the groups, depending on who we're talking about, they are to a degree, but some people are completely immune to it because of where they live and how they live, and they know what's going on. Definitely. But there's an agenda, and there are different people involved in the agenda, different levels and who knows how that all goes. But some people are being affected by it. Yeah. And then there are people too who, of course, think that if they do get sick, they'll just buy their way out of it. They'll cryogenically freeze themselves, and in 20 years when they find, there are those people too. Yeah, cut their head off and, cryogenically, yeah. So that's that's a good question. But we all live in the same world, but different levels of us have different protections that we know of.
Some of them, they grow in their own food.
Some are growing their own food, yes. Yep. Yeah, like you wouldn't be eating the same food right now here if you were, I'm sure, living in Washington, D.C. You wouldn't be eating the same food that you're eating here as you would be there. If you were, highfalutin, had your own food shipped in, and read a little while ago, there's only a couple places in the nation that don't have 5G. Washington, D.C. is one of them. It should tell you something, right? Anyway, I just bring all kinds of good news, don't I? Just always. I'm just a bright and shiny. Oh, we do have giveaways. Let's do some happy stuff. You guys want giveaways? Anything else? Any other questions? Good question. Good question. I know it's a pain in the waz to learn all this stuff, and it's like, why do I want to wake up to this? I'll tell you why you want to wake up to it, so that you can avoid it. That's the only reason. Say what now?
I was going to say those 5G towers are such an eyesore.
They are.
They're eye pollution.
They are.
And just
Absolutely.
wicked.
And when we're in Mississippi, they have posts every going down
Yeah.
because the 5G needs the other stuff because it only goes 5 feet. So every
Yeah.
5 or 6 feet, there's just little posts there, and they hide them behind the telephone pole
Mm-hmm.
and all those.
Yeah. And all of your water towers now have, a lot of water towers will have 5G. Like the beautiful, iconic water towers that we all grew up with, now there's just the big, 5G crucifixes on the top of all the water towers. Yeah.
Following all this stuff the past 12 years.
Microphone, yes.
I really be following this.
You've been
all
following
this,
the 5G thing?
No, all this
Or-
information, transhumanism,
Mm-hmm.
genetically modified, all those things that you pretty much 90% what you cover.
Mm-hmm.
And I had a big experience with the Lord Jesus Christ about 12 years ago. And I believe in the word so much when he says that Jesus died for my infirmities,
Yeah.
that even if I eat something poison that would affect my body, I exercised my faith in that direction so much, and all of a sudden I had a heart attack. And my mind was ballistic. So what's going on, God? I believe in your word.
Yeah.
He says that even if, so this might be for somebody that is listening. I don't know, that we have to be, disciplined when it comes to this kind of things. We cannot just,
Mm-hmm.
some stuff, faith won't do it. You have to have faith in God. You have to believe God. The
Right.
word is the word, but you have to be aware
Mm-hmm.
of what's going on.
You have
'Cause
to know.
I
Yeah.
exercise my faith so much on that particular word
Mhm.
that I never really bother what I ate. It says, this ain't going to affect me. I believe in the Lord Jesus Christ, and this is not going to do nothing to me. And he did.
Right.
I'm not mad with God. I love God. I believe in him. And I blame it on me not to take it seriously.
Well, and here's part of that's a great Al. That's a great observation, man. Because a lot of people, I'd say, could reflect that, could relate to that. And here's the big thing that comes through when people back then. When those words were written, no one envisioned a Pop-Tart. No one knew what an artificial sweetener was. No one knew what red 40 and yellow 5 were. Those things didn't exist.
Ice cream, Nutella.
None of that existed. So back then, if you take up poison, if you took up a serpent, or if you took up poison or arsenic or cyanide or something, which probably didn't even exist back then either. But if you were to take up poison, it wouldn't hurt you. That makes sense. But when we're taught from day one that all this stuff's good for you, you're never going to think it's poison right before you eat it. Does that make sense? Hold on one second. So does that make sense? So a lot of people don't know that they're praying over their food, but they're praying over stuff that's not food. The Apostle Paul would not have recognized, your pasta and linguine and, breadsticks and, they would not have recognized this as food. It would not have been recognized as food. It would be, food-like substances at best.
And in the back of our mind, each one of us know, just don't pay attention to
Yeah.
something hits us. For instance, my son used to work at McDonald's. It cost McDonald's 39 cents to put a Big Mac for sale of $3, $4.
Yep.
39 cents is what it cost McDonald's to mount a Big Mac. What is that?
Yeah, yeah.
It's, who knows? Now it's genetically modified, laboratory grown meat. They're doing it cheaper and cheaper and cheaper every day. Good points, good points. What were you going to say, darling?
Just that it's not much, but just to add to what he was saying and what you were saying is that in the word it also says my people perish for lack of knowledge. And that scripture has stuck with me for a long time, and that we should yearn to seek out that knowledge, to seek out, what Dr. Brett and his team associates are giving us, the important, vital information. It's that we just don't know, and we're perishing. The world is perishing because they don't know the true knowledge, because they don't seek it out, and that's it.
Right. And the whole point of what we're saying too is, see, we trusted all of the stuff that rolled out about the CV19 thing from authorities. We trusted the CDC. Well, I didn't, but many of us fell for it. We bought the CDC crap. We bought the WHO crap, at least for a day or two. Some people are still buying it. But see, just like the same way that we all bought food science, we, back in the, 90s and the 80s and the 70s and the 60s and the 50s, people all of a sudden were convinced that animal fat was horrible for them, and that we're going to make, margarine, and it's going to be great for them, and we're going to get women off their, we're going to throw off their hormones, we're going to jack up, this, we're going to jack up that, and before you know it, one generation later, everybody's on meds, everyone's falling apart. Life expectancy is what, 30 to 69? What percentage of people are dying between 30 and 50? So something didn't work back then. They were telling us all this crap food science was being paid for by the crap food people that were making it. Just like all the crap we just went through is being bought and sold, paid for, and profited off of by the people who are running these organizations, patenting the viruses, patenting the vaccines, and patenting the tests to detect the disease that may or may not even be associated with the stinking virus. So we've all been hoodwinked, we've all been screwed, we've all been lied to, and it's all crap. You just have to trust the Bible, trust your physiology, and trust your logic. So if somebody comes to you and says, hey, this vaccine's good for you, you can look right at the label and go, my people don't perish for lack of knowledge anymore. Boom. Now I know what some of this stuff is. I can look at the ingredients and go, yeah, that causes cancer. That's a laboratory chemical. This is an embalming fluid. This is, If it's poison outside the body, it's poison inside the body. I don't care how free your vaccine is. Peace. Does that make sense? So we've all been lied to, Al. Man, we've all been lied to. I went to college for 15 years. 14 and a half of that was lies. Crap. It was so nice. When you figure it all out, you figure out how long you've been lied to. It's the majority of your life. Majority of the stuff you learned. Anything else? On a positive, uplifting note like that? It's all crap, and we've all been lied to. But I like that shirt, Janice.
I know.
Yeah. Anything else? Anything else? Questions, thoughts, ideas?
I'm not saying positive. I just
Send
think it's really good that you are just trying to spread that information to people, that you're trying to get that out there. So on a positive note, I just think that's great.
Thank you. Thank you. Appreciate it. Yes. Yeah, I appreciate it. It's hard because, it's a lot of stuff that, a lot of people don't know, or they might think it's a little batty at first, or they might not think, you thought I was absolutely off my rocker, back in the day, and you still probably do. And she's worked here for a year now, but it's hard because sometimes it's harder to wake people up than it is to tell them that, hey, to tell them that they're sleeping. Yeah.
You know, that's supposed, and they're just like, I remember that used to be a thing. It's
Yep.
like, hey, did you hear about what happened?
Mhm.
You know, this morning, blah, blah. No, you're kidding. No, it was on the news this morning. Oh, my goodness.
Yep.
And there, that's it.
That's it.
That's the stamp of approval that it's.
If it's on the news, then it's legit.
That's
Well,
right.
well, let's talk about in the last 6-7 months, people have been getting pulled off TV, getting pulled, their websites being pulled down. All factual, heavy-duty stuff that people have put their lives into is disappearing very quickly. Some people's YouTube channels are getting pulled down, their Facebooks are getting shut down. Comedians, they're even coming after comedians, for God's sake, who are standing out, who are standing up against some of it. So you really need to be aware. Like, there is a reason why some of this stuff is being censored now, and you have to be aware. So if you're trusting what your medical doctor is saying that was bought and paid for in a program, a curriculum by people who propagated the idea that pharmaceutical medications were the only cure for disease for the last 100 years, that's been our mentality. We've been demonizing all of the plants and the animals and stuff while we've been praising all of these genetically modified laboratory concoctions of chemical cocktails. Completely anti-God. You want to know a good place to figure out that? Look at my class for pharmakia from 2-3 weeks ago. What was that? 2-3 weeks, and you'll see like a little bit of the background of where all of this stuff comes from. You'll see it's completely from a different realm, and you don't want anything to do with it. So don't feel bad. We've all been lied to. It's just waking up to it. Everybody does it at different speeds. It's sad because it's not fun to wake. It's not fun to realize you've been asleep for a long time. So on that note, we'll give away some free stuff. Anybody else? Questions, thoughts, anything on Facebook? What are you laughing about? What are you smiling? I got everybody to turn and look. Everybody just, I love it. Anything else? Questions before we sign off? Next week, we're going to do Vaxxed Part 1, the Vaxxed movie. If you've never been to this, if you've never seen this movie, you'll want to check this out. You want to know what's going on with the WHO and the CDC? Check this movie out. And this movie came out 5 years ago, and the stuff that this movie talks about was from 20 years ago. So if you really decide to trust these folks,